Hey everybody, Dr. Dassani here, and today we're actually going to be talking about some of the most common signs and symptoms of sleep disordered breathing or even sleep apnea in our kids. What is it that we should be looking out for as parents in our kids so we know to have those conversations with our healthcare providers, be it your pediatrician, be it their ENT, or sometimes even your dentist. So first and foremost, the most common and easily recognizable sign is snoring. If you notice that your child snores consistently, regularly, bring it to the notice of your doctors. I tell parents all the time, record them with your phone, take it to the MDs, to the pediatricians, so they see what you are seeing. Another important sign that we miss a lot of times is bedwetting. If you have a child that has stayed dry previously and is starting to have accidents again, they're beyond the age where they've regressed in their potty training. This is older kids. We're talking 7, 8, 10. We even have a 14-year-old. And everything else has been ruled out. Make sure that sleep apnea or lack of healthy sleep is being considered. Morning headaches. If you have a child that is waking up on the wrong side of the bed, is a bear to wake up in the morning, is unhappy, complains that their head hurts in the morning a lot of times, that can be because of lack of enough oxygen to the brain when they're sleeping. Nightmares, if you have a kid that has a lot of nightmares. Again, this is something to be considered. We're also going to be considering chronic allergies. Kids that constantly have stuffy noses, runny noses, ear infections, throat infections. This can potentially be something that we want to consider. Tooth grinding is a big one, big one. Anytime you notice your child grinds their teeth, do not wait until their next appointment. Go mention this to their dentist. Kids with swollen tonsils, this ties in with them constantly getting sick. They have sore throats, runny noses, fevers, and this happens way too many times. When you're seeing your pediatrician, have these conversations. Sleep, talking, and walking is another big one, as is daytime sleepiness. If you have a child that is constantly tired, drags their feet throughout the day, has a hard time getting along with their friends at school, has a hard time focusing at school. Again, this then leads into symptoms of ADD and ADHD. If you have a child, if you know somebody in your life that has been given the diagnosis of ADD or ADHD, and needs medications. Sometimes they do need it. Yes, it is warranted. But I always advise parents, make sure their sleep is healthy. Make sure that is being ruled out before we jump to medications. So hope this helps. Things to look out for in our kids. I'm going to do a quick run through here. We're going to be looking for snoring, bedwetting, symptoms of ADD, ADHD, trouble focusing at school. Do they have nightmares, sleep, walking, and talking, tired all the time, morning headaches, tooth grinding, chronic allergies? If they're sick all the time, this is the time that we want to make sure we are having those conversations. We will see you later. Have a great day.